wound care after surgery. So this is a tricky one because it depends on the wound. But if we're talking plastic surgery, generally what we are going to tell you to do is obviously follow your doctor's advice. And if they say don't take a dressing off, then you do not take it off, okay? That's as a standard. However, if they're like, no, it's okay, you can remove it, or you're not even wearing a dressing, then spray Clinisect on it. Clinisect Plus is absolutely amazing. Spray it into the gap where, don't be pulling anything apart, but into the gap where the tissue needs to join together. And that's an antimicrobial, and it will make sure that the bacteria that would be slowing down your healing is killed off, and then you heal faster because your body can cope with healing rather than dealing with this bacteria. Then your wound knits together. Essentially it does that quicker then, and if your wound knits together quicker, you will normally get a better cosmetic result because it hasn't taken the same amount of time, so everything moves back together. You know, if you get a paper cut and it heals back quickly as opposed to something that's deeper, you're less likely to see the paper cut than a deeper cut. So that's the reason, because it heals back, or kind of the reason, because it heals back quicker. Okay, and then after that, when the wound is closed up, you're going to need someone to do some specialist massage on that to make sure that the scar tissue doesn't become a bit of a problem building up around the incision. Okay, and this is when you can, when all that redness and stuff's gone, that's when you can start wearing the scar tape. And we always recommend lipoelastic. They've got a really thick scar tape that you can wash and then put back on again. It's brilliant. It's silicone, assuming that you're not allergic to silicone or anything, because it puts some pressure on the wound as well, which means it's less likely to become raised because it's being pressed down. So it's really good stuff, really good stuff. And they also do a gel as well if you're not keen on that tape. I prefer the tape, but the gel, if you do get it, you just put some on your finger and you don't rub it in, you just put it on like that, and then you're creating that barrier.